Good afternoon, but also good evening and good morning to many of us. It is our pleasure to welcome you to the 10th ITM alumni webinar focusing on COVID-19 in Guatemala, understanding context through rumors tracking. In the ITM alumni webinars on COVID-19, ITM alumni present their impressions on the current situation of the outbreak in their country and highlights how they are engaged in this global fight against the pandemic. The main aim of this series of webinars is to share experiences, expertise, and good practices within the ITM community of alumni, students, staff, partner institutions, and the wider global health community. Our today's moderator is Marlon Garcia Lopez. Marlon is a senior expert in public health and humanitarian relief. After his MPH studies at ITM, he worked more than 10 years for international organizations such as WHO, France Expertise Internationale, BTC, and the Global Fund. Previously, he worked as responsible of programs for MSF France at the Paris office and as a country director in several Latin American and Asian countries. Since 2014, he's working at ITM as a program coordinator for the Master in Public Health, as well as for the advanced short courses on health policy and system research methods, health policy and governance, social protection in health, and health system strengthening. Marlon, please. The floor is yours.
Yes, thank you, Charlotte, and good afternoon or good evening to all of you. Greetings from Antwerp, Belgium. We are here in the winter time, but glad to have you there. So, as Charlotte say, today webinar is about Guatemala, and in Guatemala we have an alumni who is the main speaker today, which is Guillermo Hegel. Guillermo Hegel is an urban health advisor who began his career in public health in 2000. Since then, Guillermo has been promoting a small-scale project at the community level and focusing in environmental and intersectoral approaches. Between 2008 and 2013, he worked at PAHO WHO in Guatemala. He was then an advisor for social determinants of health and healthy cities. From 2000 to 2020, he worked as health director for the municipality of Villanueva, Guatemala City. Currently, he is coordinating a research project on governance and accountability in urban health system and a COVID-19 response project. Guillermo, please, the floor is yours. Welcome.
Thank you very much, Marlon. Nice to see you both. As you mentioned, we're going to be speaking today about understanding context through rumor tracking. I have a presentation. I hope that we can finish that in 20 minutes. And this is a project that it's being developed by PCI Global. This is a partner of Global Communities and is funded by USAID and its Bureau of Humanitarian Assistance. So I'm going to start my presentation. I have some slides about the general context of COVID. I will try not to stop too much on that slides, but to give you a general overview of the problem, and then we're going to go into the rumors tracking strategy that we have implemented. So Guatemala, it's an 18 million inhabitants country. So it's a small country, but it has a population that it's quite big for its size. And half of the people that lives in Guatemala are under the poverty line. 25% lives in the metropolitan area, and of that, it's important to acknowledge that there's a rapid growth. We are expected to be mostly urban by 2030. That it's impressive for this type of context and country, but this is happening already all over the Latin American region and now in Central America. So we are one of the 20 countries in the world with highest inequities compared to some African countries and part of the Middle East. About the timeline and some confirmed case to give you an idea of what's going on in the country, you can see here the cases confirmed by COVID during the pandemic here in the outbreak in Guatemala. And the first case happened in March 13 and the first death in March 15. After that, a national commission was established, and over the time, there have been a lockdown and curfews that went through until almost the whole time of the pandemic. But the reopening strategy was like released by the Ministry of Health in June and started to be implemented during those months, actually around August. But during July approximately, traffic light came. That was a COVID traffic light that was implemented by this commission, the National Commission to Prevent COVID Transmission. And that was used to show which municipalities were doing good and which ones need to have more rules about COVID. Finally, and you can see the different ways that the curve behaves. Here, for example, in the opening of the airport, and we have an increase of cases in 1918. And since then, one of the main problems that we have had have been the lack of enough testing and important difficulties implementing budget. That's why at the end of this year, we have had massive demonstrations by the population trying to show their discomfort about the way the budget have been managed. But now we're back in track. But I'm going to show some other slides that might give you a better understanding of this behavior of Guatemala. So for example, here we have the biweekly cases per million people, and you can see that compared to other countries in Central America, we have a low amount of cases, but this is very much because of the amount of testing. As you can see here, we have a very low testing per day compared to, for example, Panama or even Costa Rica and El Salvador. So that means that the amount of cases that we have are related specifically to those tests that the government implements in coordination with other organizations. And this one is very interesting because it can show you one important measure that we have in account, that it's the percentage of the positive cases from those that have a test. So you can see here the negatives are in pink, and then in purple you have the positives, and then the percentage is marked by this curve that you can see here, that trend. So an important fact for us is that even that the cases have been not that many, the increase in deaths from this study that was made during the pandemic here in Guatemala, you can see how the deaths of any type have been increasing from week 20, epidemiological week 20, for the people living in 40 to 59 years old, 60 to 75, and 75 plus. So you can see that at the beginning we had a decrease in deaths, actually because of the curfews, other types of deaths that are very happening often here in Guatemala, such as deaths by violence or traffic accidents, among others, decreased importantly. And you can see here an important decrease as well in the ages from 0 to 4, 5 to 19, and 20 to 39. So it's not only after the measures were released, that started again to rise these deaths. And there are other important facts to it, so we're gonna look at that closer afterwards and come back if needed. So specifically about the project that we're working at, it's as I mentioned, a PCI Global project, and that have been partnered with the USAID Bureau for Humanitarian Assistance to strengthen local capacity and prevent the spread of COVID-19. So we have been like, the basis of this project are community involvement, and as well, the most important is risk communication strategies that involve as well community involvement, and the dealing with rumors that has been an important way of misinformation here in Guatemala, but I believe with the infodemia that was going on around the world was an important topic, an issue for other countries around the world. So strengthening community capacity and mobilization, supporting adaptation to outbreak was and is part of an important part of the project, and to increase access to basic supplies for hand washing and infection prevention and control. So these are like the core parts of the project. We are working to achieve that in a short term of time. The project started in July, and we have got for now barely an extension that is going to take it until May approximately from next year. But initially it was until December, so almost until now. So we have been working in trying to work on evidence-based and rapidly scaled interventions that includes actions around rumors, as we're going to speak today, and as well other actions at national level and local level to coordinate with community committees to respond to COVID, and as well with municipalities and the Ministry of Health. The areas of intervention that we have are these two. So we have a very urban area in the metropolitan region of the country involving 7 departments, and then we have another 7 municipalities, sorry, another 6 municipalities that are very rural in the region of Huehuetenango, that it's in the highlands of Guatemala, here in the corner in the border of Mexico. So why are rumors tracking important? Well, it has different characteristics. You can imagine, as information can save lives, and mostly if it's provided accurate and timely from trusted sources, helping people to make better choices. And rumors can indicate as well the behavior and the status of the local needs, and it's very much at the core of the conversations that people are having at a local level, trying to understand the national movements, but as well what's happening at regional level, and what are the main concepts or misunderstandings at local level. So it's very important as a feedback tool that can give us insights and different formats, and help us to think of what people are not understanding well, and what things are very much in solid basis to overcome the disease that we are focusing on, in this case COVID-19. So it helps as well for transparency and accountability, because NGOs can hear from the people directly what they are thinking, and what they believe it's important to address. And that way, organizations and humanitarian organizations specifically can work with them to try to overcome those specific problems. So it helps to improve this connection and understanding between both. And then it's important as a protective measure, because it helps you to have access to information that it's possible reducing and helping to reduce tensions between different organizations and the population, and that will provide a better space or a better situation for the staff that is working in the NGOs, but as well to understand what is the information lacking at local level to improve the protection as well of the people that it's under, well, the specific situation. So to do that, we have identified many different organizations and actions that have been doing this for a very long time. It has been implemented by different structures, and we have collected those learnings and lessons that those organizations has given. For example, Internews, that it's well known for rumors tracking, and have these 4 functions that they implement for rumor tracking that includes the mechanisms to determine and document which rumors are circulating, an effective strategy to fact-checking information and rumors, and a variety of accessible, inclusive mechanisms to share accurate responses to rumors, and mechanisms to share community voices with humanitarian and other stakeholders. So for us, it was important to have this type of structures to help us to organize what type of actions we're going to be implemented for each of these functions. And we came out with this rumor tracking strategy that starts with the coordination with the local actors and the registration of an analysis of rumors that involves a specific app, and the participation of all the facilitators that we have on the field in more than 100 communities in these municipalities that I mentioned. And then the feedback from local actors that it's being organized by not only tracking those rumors and collecting them, but as well organizing some trainings for the local committees that we are working with to come out with some people that it's very interested in try to help and understand the negative side of rumors and how they can be tackled. So they are organizing anti-rumor agents, we call, and they're helping us to give us feedback and to implement different workshops with people as well at local level to understand and disseminate anti-rumors messages. And then those messages, well, they are designed, tested, and disseminated, and we give follow-up and evaluate actions taken. So because this is an ongoing project, we are in like we can say the second phase of registering and analyzing rumors and having feedback already, and we are starting. This is going to be an iterative cycle that we're going to be learning from, and we're going to be understanding better what rumors are like. So for us, it's very important to understand which rumors matters. For that, we have identified 2 important aspects that help us to get to a risk that means we clearly understand if this is really happening and what kind of outcomes could it have, considering the potential harm that it can do. For example, if you start hearing that cutting yourself, or I'm just using a simple example, but if you're hearing that to overcome some problem or disease, you need to puncture or cut yourself, that's very visual harm cause. Yes. And then we have all these questions that you can see here, and when we don't have answers to some of them, we just keep them with those rumors, and we try to find like a trusted source in different in all the different networks that we have, including the partners and kinds of CDC or WHO organization that work with us. So just to give you some preliminary findings, we can see here we have collected until the 24th of November. So we have collected another week of rumors already. And today there is going on a new analysis for the next week. So, but the ones I have here are only until November 24th. And it's important to see that depending of the municipality, rumors change. Yes, so we have very specific and detailed information for each municipality, including the language and who told this, what was the main source of this specific rumor, and who heard this rumor from the people that it's telling the rumor to us. So, but here we have only the classification by origin, and you can see that some of these rumors are more from Huehuetenango, like some of the municipalities are from Huehuetenango, the others are from the metropolitan region. So the first one is very much from Huehuetenango, and we're going to learn a little bit more about that one because I choose that one to show some examples. But there are, as you can see, rumors classified as absence or non-existing of the virus. People doesn't believe that the virus is out there and it's killing people. Another important, or the second in rank, is the self-medication. So they say, okay, the virus out there, but I can medicate myself and I'm gonna be fine. Underestimate the severity of the disease. That's a little bit connected as well. But it's more like saying this more like a flu. It doesn't do nothing. Or natural remedies and practices that it's related somehow to self-medication, but doesn't get to the level of taking pills or drugs. But it's just preparing specific teas or doing a practice to go to the Temazcal, that it's I don't know, a cave that they have in these regions made by mud bricks, and they put heat inside to steam. And the lack of trust in health services, the God's protection, that we're gonna come back to that one because it's important, is more specifically in Huehuetenango as well. Self-medication is more of the urban area, and then you can keep looking at those different rumors that we have. For example, here we have the setbacks about the vaccine, and here we had in these weeks only 4, but the last weekly analysis that we did, this was coming very much up because of the situation. Now we are having a vaccine that is going to be disseminated or implemented in Europe. So people starting again to come back to this discourse. So we're going to see more and more probably about this. And there are some other rumors here. So it's important to acknowledge that many of this are not necessarily directly coming from a telephone, a network, or the TV, but they are more coming from a neighbor that saw those in these devices. So it's more like something that comes from mouth to mouth and not necessarily directly by social media or social networks. Another important aspect of rumors is to try to categorize them at the type of rumors that you are collecting. So we have identified 5 different rumors. Those rumors are more specifically, as you can see here, there are quotes in Spanish. So I'm going to translate some for the protection rumors. Something that have been said many times is that the blood of Christ will protect me. So this is a like insight line or a punch line to say I will not wear mask, or I will not comply to distance, or because the blood of Christ protects me. So this type of situation, it's important to well, or rumors, it's important to have in mind, even that they are not necessarily on top of mind right now, but there are important rumors. Some kind of wish rumors are, for example, the next year we're gonna have the vaccine and everything's going to come back to normal. So this type of rumor is like wishful thinking, like next year everything's gonna be okay again, and this could well, embed different problems, but not necessarily. So you need to understand that, at least classify them. There are rumors of disbelief that could be very dangerous, as we saw before, saying that the disease doesn't exist, or is just a flu, that it doesn't kill. Or fear rumors that is more related to, if I go to a health service, I'm going to get contaminated, and then I will die. I I rather stay at home, even if I'm feeling very sick. Or criticism rumors that are more like tending to conspiracy theories, like the government is behind this, and things are are bad because they want to keep going their corruption and to steal our money. So these are rumors that we have collected directly from our from our application, and through and have gone through the analysis, and these are some of the examples. So this that you can see here, probably you cannot see the small letters, but we have gone through two levels of classification. The first level, well, the first is the type of rumors that we have just discussed here. For example, we have here the disbelief, the protection rumors, and the fear rumors. And then we have given a specific classification to those that we have found here. So we have here the to underestimate the severity of the disease, and you have here that we have coded it as skepticism and disbelief, or lack of credibility of the government. So some of them appears more than once. And then we have here all different codes that you will be able to go through after the presentation. So I just wanted to include it here to let you know how we are classifying this information. And then those quotes are going to keep growing, and we're going to have like this mental map with all the different aspects that could be used or are important to define which ones are true, do the fact checking for those that need it, and keep going in our strategy. So after that, we kind of have a like an identification of which ones are like with a major risk, which ones have a moderate risk, and which ones have a minor risk for the specific understanding of the local communities and municipalities we're working with. And for example, I highlighted here Huehuetenango, coming back to the previous slide I mentioned, with the absence or not existence of the virus. And we can see here that in this this is a partner of us, that it's the University of Rafael Andivar, that is working with a network of universities to project the amount of cases in the future of the different municipalities. And as you can see here in this map, right now, Huehuetenango, that it's here is this one, have only 3,000 cases. But the projection shown by the INSEAD, that it's an Institute of Rafael Landivar, Universidad Rafael Landivar, have shown that they're going to have an important increase in the next weeks, and it has been coming this way so far, and we believe that it's part because of the amount of cases they have and the amount of testing they have, because they don't have that much testing in this region. For example, there are municipalities we're working with that have only 3 to 5 tests run. So this is an important issue for them to access better testing. And at the same time, people live very far from each other, and they are not very much connected to the reality of the urban areas of this region as well, where well, transmission is very much and more active. So another important issue we have found here is that a survey made by the National Commission of COPRE-COVID, they were one of those departments in which people doesn't use correctly the masks because they don't care that much, actually. So this could help us to explain a little bit about that, and to try to come out with different messages that could help to improve that. So I'm going to finish my presentation here, and then we can have a conversation about what did you understand, and do some questions and come out with some clarifications. So we have been working with telephone companies. So we are going to be sending SMS and social SMS and messages through social networks from our side, but as well working with local actors that have different types of social media or information channels to provide this type of information that we have identified to be relevant, and that will provide some clarification for those rumors. And then the anti-rumors agents that we have been working with a community level organizations, which are developing their own anti-rumors messages, and they're going to be spreading those anti-rumors messages through different means that they have. So mouth to mouth, or using WhatsApp, Instagram, Twitter, those like social networks that are accessible for them, and they believe that are the most relevant at community level in those 105 communities that we were talking about. And then we're doing some incidents and working in coordination at national level and municipal level with a health cluster at national level, in which many organizations participate, humanitarian organizations and international cooperation, and the subcommittee of risk communication as well of this national cluster. And at the same time with the Ministry of Health and the National Commission to Prevent COVID transmission, which have been an important aspect to understand better and to try to help them identify which are the rumors going on, at least in these two regions that we're working. And at the same time, we're going to be working, and we are already doing that with a municipal level. So at the municipal level, we're trying to strengthen the access to evidence-based information of different sources, working with the University Rafael Landivar, and trying to use this to improve their decision making and having these inputs of the rumor tracking that we're doing. So this is all part of the actions that we're going to be implementing, and this is, for example, a guide that we made for that purpose. And these are some of the messages that have been spread through WhatsApp and other channels. And these are messages that are most specifically, they're in Spanish, but they're related to the cold and because now it's starting the cold season. And these are specifically text messages to those communities that doesn't have access to smartphones, for example. So it's promoting the preventive measures and the use of the mask and wash hands and keep the distance and so on. So I'm going to stop here. So thank you very much, and I hope you enjoyed the presentation. You have some questions. So Marlon, thank you.
Okay, thank you, Guillermo, for this very interesting presentation and interesting intervention indeed. We will now go straight to the question and to the debate. I understand that, and everybody understand that rumors as well as fake information of infodemic has been affecting health interventions since long time ago. However, for COVID has been very, very interesting to see how government has been affected also by this kind of discussion and about how they are doing and the fake rumors, what is true or not. And then there is some question already in the from our public, and I will try to summarize or to group. There is a question related to the methodology you are using in this project, one. And another question is about the how you will use later. So I will probably start by those that talk about methodology. The first one is how do you collect rumor data from community? Which methods are you using there?
Okay, we have two parallel strategies. One is, as I mentioned, I'm going to go back to that slide. Give me a second. So we have two parallel strategies. One using a specific app made in the platform called Conquer. So this is an application that all the facilitators that are working with us on the field have it. So we have people visiting homes of different beneficiaries that might be positive cases of COVID, or they are suspicious, they have a contact with another case, or they are high risk population, and we have different criteria for that. So there's a group of facilitators that it's helping the Ministry of Health to track those patients that are staying at home to check the level of risk. And with this app, they collect the rumors when they speak to these families, and somebody tells something about what they believe or what someone have been saying, and so they collect that way. The other way we collect information through the app is with the other group of facilitators that we have, that it's more into strengthening the local committees. So they implement 10 different sessions to develop an emergency plan to act about the situation that it's going on about COVID in the communities. So they have this app as well, and they coordinate while they are having these sessions with them. If something comes out, well, the information is collected, and then they have they are always active. So if they have another connection or conversation and something important comes out, they put it in the app as well. So this is one strategy. The other strategy, it's more related to like participation action research actions that, well, we came out with the idea of the methodology of how to implement that from that specific type of research. And this is a specific training that it's given to these committees to identify which ones want to be part of the process of identifying rumors and tracking them. So these persons we call anti-rumors agents, and they participate in 2 specific sessions, and then they help us to define these rumors in a participative way with different actors at a very local level, and then to come out with a specific anti-rumors anti-rumors messages that they are in the process of developing right now. They don't have it ready. This is the reason I didn't share those with you. So this is the two ways we collect rumors. As I said, thank you, Marlon.
Yeah, I think the question about the app, they wanted to know how this app works, but I think you provide some information. Otherwise, you want to extend a little bit more about the technicality or how is this app has been produced or created?
Okay, the application came out with there's a specific like rumors log that you need to have, like different types of information that should be collected when you're looking at rumors. That comes um, like a survey of like different questions of topics, like when it was collected, who told the rumor, um, does this person believe the rumor is true or not, um, and so on. So you have all this information got into the application, and if possible a picture or something, and then the information is collected into a database, and that database is analyzed and codified every week by this multidisciplinary team that has an anthropologist and a communication specialist and a social media specialist as well, to go through this information, and then comes out with some of the understandings I have shown in the presentation.
Yes, indeed. There is 2 or 3 questions related how the result of this intervention. In fact, the first question that is really questioning your intervention that in the whole context is about if the cycle you describe in this this cycle that are you showing here in will be fast enough to really counteract the rumors. That means it will not take too much time before to provide you the necessary information to counteract. That means the damage is already done.
Yes.
What do you think?
Yeah, well, this is always a challenge. I believe that rumors tracking have many benefits. One of it is to be able actually to counteract or to try to reduce the risk of this specific rumor, but it's not necessarily an easy way out to really show that your actions are going to change the behavior of the situation in the region you're working with. So it works, and we have been going through probably from November until now 4 cycles of understanding rumors, and it's just actually now that we are managing to come out the first time with specific actions that can be taken, because that needs the preparation and design and testing of the anti-rumors messages that will not say that it's an anti-rumor, but you will need to have different types of strategies. For example, we are planning, and we are on it already, to have a radio channel in which someone that have been gone through this information can provide answers to people calling, for example, to the radio, or to speak about those rumors we have identified. So the most important aspect is that if you provide information and you put this information from trusted sources, and if you well, build capacities around these committees of how to identify what is a rumor and what's not, the capacity will not only be used on this specific project that we are doing, but will be embedded in the community, and they will use this knowledge to address other types of emergencies that comes afterwards. So this is something that should try to give you enough information in a short cycle, like every week coming out with different ideas. And we believe that at a certain point you will not receive more new information, and it will just move from one rumor to another, and then you will have the information already to counteract, to attack those rumors. But at the same time, in the long run, it will help the local organizations to understand where to look for good information to respond to these situations.
Thanks. In the same frame about the usefulness of this intervention is Ariana, that you know well, is thinking that most of these rumors are related to belief of people, are really deeply inside of them. And she asked herself, she asked you, do you think that it will be easy to change the behavior, trying to tackle this deeply belief, and it will take time, I think. And she want to know also if you make a distinction between these rumors that we can manage by improving communication and trust, and those that we cannot change, like the rumors linked to God or to natural remedies.
Exactly. Yes, you got the point, and I was going there. God's protection is it's a deep belief of of religion related issue, but the reason we can, or the way we can focus on it, is to try to, when we found that this is a priority, we need to change our strategy, and instead of trying to connect directly with the people or through social media, we need to work with churches that are there, and the priests in the local region that are key actors in the information that they will they will listen to. And rumors are very much related to emotions. So and it reinforces when more people believes them, even if they are good or not. So a rumor is not always something bad. There are good rumors as well, or rumors that can do some good, for example. And in this case, we're looking at using information that, for example, cites from the Bible that that generates or promotes the use of mask and distance, and we have already found those, and they are already on the environment. Some rumors that are more related to those good practices that the people that believes in God implements. So as you say, it's difficult to change a specific pattern, but if you find the way of connecting with the organization or the institution that might, or the key actor that might help you to improve that situation, it's possible. So it gives you at least a path of where to go. Mm-hmm.
Thank you, Guillermo. There is also two questions that are more or less related, but one is about how to develop convincing information to give to people who think the COVID doesn't exist, especially when the confirmed death cases are low. And the other one is, regardless, your project or your intervention is still not in this phase, but maybe other actors have implemented already anti-rumor agents. Did you see already some impact on the number and type of rumors of those agents?
Not yet. Not yet. We're just. I'm going to answer the second question first. They are being trained right now. They're in the process of training, and they haven't started. And they're well. The second phase of the training. So there's two sessions. One in which they learn very much of more about communication and how to identify rumors. And the second is how to develop the anti-rumors actions that they will implement. So we're training right now the groups, and we're going to find out this probably in January for sure. So if you would like to have more information, I will be happy to share it with you in January. About the first question, it's a very important one, and we are facing that right now. So there are specific practices that prevent transmission, like distancing, washing your hands, and trying to stay at home. So we have been trying to go through that channel while we understand more about the reasons behind it. Because as you mentioned before, some of the participants said that we might get um, um, not in the proper moment, but after, the increase of cases might get to those places. So it is important to think that testimonies are very relevant. So we have in the for sure, every time closer, the people have someone that has been like that had the disease, or another person that died already because of this. And this testimonies and communication tends to have a strong effect in those in other participants. So this is an important way to communicate, to try to find which information is relevant, to show this information to them, to different channels that at the same time gives us the understanding that is happening. For example, the excessive mortality that we have had. So trying to give information to people in a way that they can understand and they can relate to it. Because it's really difficult, as you mentioned, to live in a very far community, staying at home, and just think that this disease is going to get you right there.
Okay.
So
Yes,
yeah.
thank you, Guillermo. I think we are arriving to the end of our webinar, and I have just a last question for you, and thinking in more how to strengthen the health system in our countries. I saw that you have a network where you can discuss the rumors and have some kind of advice. But my question is, how do you see the involvement of the government in the future, in the sustainability of the benefit of this kind of intervention? There is interest, or there is something that they let you do because you are a project and you have the budget to do, and you know how it is.
Yes. Well, we have the cluster, the health cluster, and the subcommission of risk communication, and we are trying to well, give some feedback. And this is going to be organized in January, when we have more information, like to spread some of the results that we are going to have until then. But right now, there's a lot of interest by the National Presidency Commission to prevent transmission of COVID. COPRE-COVID is the name of this commission, and we're having a meeting this week. And the Ministry of Health have shown an important interest as well. They are training people that is being hired to work at like district level for track tracing. And these people might be of use of this type of actions that we're taking. So trainings are going to be implemented for them about how to implement this type of strategies, and we hope that this might be useful for them to understand better the context and have more like better understanding as well, and shaping their strategies to improve or reduce the transmission of COVID at local level.
Okay, thank you very much. I think that was the last question. I don't see any more questions. Thank you, Guillermo, for this interesting presentation, and wish you the best. Merry Christmas to everybody from Antwerpen, and I let the words to Charlotte. Charlotte, please.
Yeah, thank you. Thank you, Guillermo, for sharing and presenting your impressions and first findings on this project, and also on the COVID-19 outbreak in Guatemala. Thank you also to Marlon for moderating the webinar. Thanks to Yves as well for his technical support. Of course, we want to thank you as well, all the participants from around the globe, for attending this webinar. And for also completing the short survey, which is already being displayed, by the way. This webinar is the last one of this year, which is a challenging year. 2020. We will go now for a Christmas break, and we will be back in 2021. So we take this opportunity to wish you and your family a safe and healthy new year 2021. And in the meantime, we wish you all the best, and importantly, stay safe and healthy. Thank you, and we hope to see you back in 2021. Thank you.